Alrighty then. So this sweet friend has big feelings about vitamin K, and I would too if I had just enough information to make everything sound real scary. But what I believe my place is on the internet is to help people whose background is not research to be able to take in evidence-based information in a way that is understandable. So I'm going to get into every point. I'm pretty sure I've gotten into I think I've prepared for every point. Okay, so I said there's never been a baby that has died from a vitamin K injection given at birth. Stand by that. And our friend has pulled up the beautiful black box warning, which I'm going to post here, and highlights this, that fatalities have also been reported following IM administration or intramuscular administration. And you are correct, in adults, because vitamin K is used for, number one, anticoagulant-induced prothrombin deficiency, aka the reversal agent for a blood thinner called warfarin or Coumadin, prothrombin deficiency secondary to other drug therapy, or factors causing limited absorption or synthesis of vitamin K, and prophylaxis and treatment of hemorrhaging in the baby. Now, I am a science-based, evidence-based girly, okay? So I want to know, what are those reactions that have happened? How do I know that no baby has ever died from that? Well, because there's studies that have been done. And this study talks about why the black box warning exists and goes over the severe reactions that have happened. So let's get into it, okay? 17 adult patients ranging from 28 to 89 years of age were represented in the case reports. The majority of patients experienced reactions with IV administration, although 2 cases of IM and 1 case of sub-Q administration were also reported. 3 reactions resulted in death, whereas 1 reaction resulted in fetal death. So this one sounds scary, right? So this one, the mom got large doses via IV because of bleeding, and she had an allergic reaction. Okay, so baby did not make it with that one, which is not the circumstance for babies receiving a vitamin K shot to prevent vitamin K deficiency bleeding. Okay, so here's what I want to know about the pediatric patients, okay, ranging from newborn to 9 years of age were represented in the case report. The newborn case described IM administration, okay, that is exactly what we are talking about. And the other 2 cases described IV administration. Sorry, whenever I'm doing this, it has the comment sticker right where I need to read. For the other children, reports of IV administration were given at a rate more rapid than 1 milligram per minute. That's really fast. But let's talk about what happened to that baby, because that's the one that we're talking about, right? That's what we need to know about. Well, good news is science got receipts, okay? So this is an article about that case report for that one baby that had a severe reaction. This was in Turkey in 2014. We hear and report a case of anaphylactic shock developing after the intramuscular administration of vitamin K1 in a newborn. To our knowledge, this patient is the first case of neonatal anaphylactic shock developing due to intramuscular administration of vitamin K. First one. And that was it. Ever. That was one baby in Turkey in 2014, and the baby lived. But then I also hear, but they're paid to say that. They're paid to say, no, they're not. Okay? There's nothing. No financial support. There's no conspiracy to save your children from vitamin K deficiency bleeding. Oh, by the way, it's not a vaccine either. I hear people tell me that all the time. It's not a vaccine. Okay, it's a vitamin. But let's go back to our friend's receipts, aka the black box warning that we are talking about. Okay, so we've talked about that intramuscular use, there's been a severe reaction, even fatalities. No fatalities in babies. 1 allergic reaction. All the fatalities were for older people. Okay, then we say benzyl alcohol as a preservative in bacteriostatic sodium chloride injection has been associated with toxicity in newborns. Data are unavailable on the toxicity of other preservative in this group. There is no evidence to suggest that the small amount of benzyl alcohol contained in vitamin K injection when used as recommended is associated with toxicity. Okay, you just proved yourself your point. But guess what? They make vitamin K without preservatives, if that is something that is scary to you. You highlighted this one. Phytonadione will not counteract the anticoagulant action of heparin. I never said it did. I said it was from warfarin because it works in different ways. I never said that. Phytonadione, by the way, is vitamin K. It's kind of like saying ibuprofen is Motrin or acetaminophen is Tylenol. It's just another name for it. Okay, benzyl alcohol has been reported to be associated with fatal gasping syndrome in premature infants. Again, There is no evidence to suggest that the small amount of benzyl alcohol contained in this, when used as recommended, is associated with toxicity. Again, and if that is something that bothers you, you can get a preservative-free version. This product contains aluminum that may be toxic. I got such a cool secret to tell you. Before we get into it, this is only if your kidneys are screwed up. So when you do a Google about aluminum and vitamin K, you may come across this meme here, okay? Where it says contains no more than 100 micrograms of aluminum. But we gotta do a little bit of math, folks. 100 micrograms per liter, okay? Look at how much this is. 1/2 of a milliliter, okay? That means that you would have to give this whole thing 2,000 times in order to equal that. 2,000 times. One vitamin K shot only contains 0.33% of the total allowable daily amount of aluminum, okay? Then she says, studies of carcinogenicity, mutagenesis, or impairment of fertility have not been conducted with this injection. Okay, but here's the thing though. Vitamin K has been standard since 1961. That's 63 years. And over that time, about 3.66 million babies are born in the U.S. every year. And 96% of those babies receive the vitamin K injection that is given at birth. Now here's the thing. With math, that means that approximately 221 million babies have received a vitamin K injection at birth. And guess what? They've been grown up, okay? So if vitamin K was going to cause cancer, fertility problems, whatever, everybody and their literal brother would have those problems. All that is saying is that there haven't been specific studies that have been done on those things. Then she highlights, hemolysis, jaundice, and hyperbilirubinemia in neonates, particularly those that are premature, may be related to the dose of vitamin K injection. Thank you for highlighting this. Therefore, the recommended dose should not be exceeded. Another myth is that the vitamin K injection increases the risk of jaundice. This is inaccurate. Jaundice associated with vitamin K was only observed in high-risk babies, such as premature babies, in doses 30 to 60 times the dose that we give. Then another of her slides, she highlights again intramuscular. We agree. We are in agreement that the black box warning says intramuscular. But guess what? Still doesn't change the fact that no baby has ever died from getting vitamin K intramuscularly at birth to prevent vitamin K deficiency bleeding. Still doesn't change that. Because intramuscular administration of anything can still be given at high doses. Then again, we have highlighted intramuscular twice. Yep, that's the way it's given, because it is a fat-soluble vitamin that slowly releases over 6 months in order to give your baby protection, 81 times less likely to experience that late vitamin K deficiency bleeding. It is not a vaccine. There is no big conspiracy out here to make sure that every baby is protected from vitamin K deficiency. Maybe that's the conspiracy, okay? I am not paid by Big Vitamin K. I wish that I was, okay? Where's the check? Because I be out here arguing in these streets for no money. Just because I care about your babies and I do not want misinformation, disinformation to keep you from making informed and empowered decisions about what you do for your baby. While we're at it, oral vitamin K is not absorbed as well because your baby lacks the gut microbiome in order to absorb it, and really depends on your strictness with how well you follow the regimen. It's better than nothing, okay? Better than nothing. Also, vitamin K is the key needed to unlock your baby's clotting factors, okay? They're born with everything they need except for that vitamin K. And this sweet friend wants me to tell you the reason that babies are deficient in vitamin K. She says that we evolved that way. It's because vitamin K doesn't pass through the placenta, nor is it really easily passed through breast milk. So babies are deficient until they develop that gut microbiome at about 6 months old. Oh, also, babies begin to start absorbing their own vitamin K after about a week or 10 days, but they are not able to protect themselves from vitamin K deficiency bleeding until they're 6 months old. That's like trusting a 15-year-old to drive a school bus of children. Oh, damn, 10 minutes. Sorry about that. This was great. Bye.